This video shows you how to prepare and administer Elocta. Read the package leaflet before use. Do not stop using Elocta without consulting your doctor. If you have any further questions on the use of this medicine, ask your doctor, pharmacist, or nurse. Elocta is administered by intravenous injection after dissolving the powder for injection with the solvent supplied in the pre-filled syringe. Elocta is available in various strengths. Elocta should not be mixed with other solutions for injection or infusion. Check the name and strength of the package to make sure it contains the correct medicine. Also check the expiry date on the carton. Do not use the medicine if it has expired. If Elocta has been stored in a refrigerator, allow the vial and the syringe with the solvent to reach room temperature before use. Do not use external heat sources. After storage at room temperature, the product must not be put back in the refrigerator. Before opening the pack of Elocta, wash your hands with soap. Elocta pack contains 1 powder vial, 3 ml solvent in pre-filled syringe, 1 plunger rod, 1 vial adapter, 1 infusion set, 2 alcohol swabs, 2 plasters, and 1 gauze pad. Place the vial of Elocta onto a clean flat surface. Remove the plastic flip-top cap from the top of the Elocta vial. Wipe the top of the vial with one of the alcohol swabs provided in the pack and allow to air dry. Do not touch the top of the vial or allow it to touch anything else once wiped. Peel back the protective paper lid from the clear plastic vial adapter. Do not remove the adapter from its protective cap. Do not touch the inside of the vial adapter package. With the vial on a flat surface, hold the vial adapter in its protective cap and place it squarely over the top of the vial. Press down firmly until the adapter snaps into place on top of the vial, with the adapter spike penetrating the vial stopper. Attach the plunger rod to the solvent syringe by inserting the tip of the plunger rod into the opening of the syringe plunger. Turn the plunger rod firmly clockwise until it is securely seated in the syringe plunger. Break off the white, tamper-resistant plastic cap from the solvent syringe by bending at the perforation cap until it snaps off. Set the cap aside by placing it with the top down on a flat surface. Do not touch the inside of the cap or the syringe tip. Lift the protective cap away from the adapter and discard. Connect the solvent syringe to the vial adapter by inserting the tip of the syringe into the adapter opening. Firmly push and turn the syringe clockwise until it is securely connected. Slowly depress the plunger rod to inject all the solvent into the Elocta vial. With the syringe still connected to the adapter and the plunger rod pressed down, gently swirl the vial until the powder is dissolved. Do not shake. The final solution must be inspected visually before administration. The solution should appear clear to slightly opalescent and colorless. Do not use the solution if cloudy or contains visible particles. Ensuring that the syringe plunger rod is still fully pressed down, invert the vial. Point the syringe upwards, then slowly pull on the plunger rod to draw back all the solution through the vial adapter into the syringe. Detach the syringe from the vial adapter by gently pulling and turning the vial counterclockwise. Discard the vial and the adapter. Note, if the solution is not to be used immediately, the syringe cap should be carefully put back on the syringe tip. Do not touch the syringe tip or the inside of the cap. After preparation, Elocta can be stored at room temperature for up to 6 hours before administration. After this time, the prepared Elocta should be discarded. Protect from direct sunlight. Note, if you use more than 1 vial of Elocta per injection, each vial should be prepared separately as per the previous instructions, and the solvent syringe should be removed, leaving the vial adapter in place. A single large Elocta syringe may be used to draw back the prepared contents of each of the individual vials. Elocta should be administered using the infusion set provided in this pack. Open the infusion set package. Remove the cap at the end of the tubing. Attach the syringe with the prepared Elocta solution to the end of the infusion set tubing by turning clockwise. If needed, apply a tourniquet above the injection site, as instructed by your doctor or nurse. Prepare the injection site by wiping the skin well with the other alcohol swab provided in the pack. With the infusion set needle tip facing upwards, remove any air in the infusion set tubing by slowly depressing on the plunger rod until liquid has reached the infusion set needle. Do not push the solution through the needle. Remove the clear plastic protective cover from the needle. Insert the infusion set needle into a vein as instructed by your doctor or nurse and remove the tourniquet. If preferred, you may use one of the plasters provided in the pack to hold the plastic wings of the needle in place at the injection site. The prepared product should be injected intravenously over several minutes. Your doctor may change your recommended injection rate to make it more comfortable for you. After completing the injection, remove the needle. Open the gauze pad and press it on the injection site to stop possible bleeding. Then apply the second plaster. Fold over the needle protector and snap it over the needle. Please safely dispose of the used needle, any unused solution, the syringe, and the empty vial in an appropriate medical waste container, as these materials may hurt others if not disposed of properly. Do not reuse equipment. Read the package leaflet before use. Do not stop using Elocta without consulting your doctor. If you have any further questions on the use of this medicine, ask your doctor, pharmacist, or nurse.